Нихон Коден has developed a non-invasive blood pressure measurement method that is quicker and gentler on the patient. In conventional iNIBP measurement, the step deflation method is used. First, the iNIBP cuff is rapidly inflated to a high target inflation pressure. Then the cuff is slowly deflated until the pulse wave is detected. The conventional deflation method has several disadvantages. Rapid pressurization causes patient anxiety. High pressure cuff inflation is painful. Repeated cuff inflation causes subcutaneous bleeding. And finally, this method is slow in an emergency. Нихон Коден has developed an innovative technology to solve these problems. Нихон Koden's iNIBP linear inflation technology provides quicker and gentler cuff inflation. Нихон Koden's Yawara Cuff 2 iNIBP cuff reduces subcutaneous bleeding. In the conventional step deflation method, the cuff is quickly inflated to a high target pressure, then slowly deflated in steps. In iNIBP measurement, the cuff is inflated more slowly than in the conventional method until it measures the systolic pressure, then it deflates all at once. iNIBP measures non-invasive blood pressure quicker and at a lower cuff pressure. iNIBP reduces the measurement time and pain and discomfort of conventional high-pressure inflation. This chart compares the average measurement time of the conventional method and iNIBP. The data is from a study of 323 measurements of 64 adult patients in an operating room during surgery. iNIBP measurement is 20 seconds faster on average than conventional NIBP measurement. iNIBP also offers a performance advantage in the case of a sudden increase in blood pressure. In the conventional step deflation method, the initial target pressure is set to 140 millimeters of mercury based on the previous measurement. The target inflation pressure was below systolic pressure, so another inflation is required at a higher target pressure. If the second inflation target is still too low, a third inflation is required. Extra inflation cycles take a lot of time. In iNIBP measurement, the cuff is inflated until the systolic pressure is reached, then deflated. There are no unnecessary inflations. iNIBP enables rapid NIBP measurement in the case of a sudden change in blood pressure, when healthcare professionals need to know a patient's vital signs as quickly as possible. This chart compares the average maximum cuff pressure of the conventional method and iNIBP. The data is from adult patients in an operating room during surgery. The average maximum cuff pressure of iNIBP was 36 millimeters of mercury lower than the conventional method. So iNIBP can reduce discomfort of patients during NIBP measurements. iNIBP and the conventional method have nearly the same accuracy. To take full advantage of iNIBP, we highly recommend using Нихон Koden's Yawara Cuff 2. This cuff is more comfortable than conventional NIBP cuffs, and it maximizes the performance of Нихон Koden's iNIBP. Conventional NIBP cuffs can pinch the skin during inflation. This can cause subcutaneous bleeding. Yawara Cuff 2 has a soft, flexible buffer sheet inside the cuff. This prevents subcutaneous bleeding. Yawara Cuff 2 is designed so it is easy to use safely and correctly. Yawara Cuff 2 uses a kink-free tube. Even if the tube bends during inflation, for instance when the patient changes position, the tube does not become obstructed. Air flows out even if the tube is bent back 180 degrees. Yawara Cuff 2 has an arm size scale on the cuff, so you can quickly check if the cuff size is appropriate. You can quickly check the correct cuff size just by holding the cuff over the patient's arm. Yawara Cuff 2 is designed to be easy to clean. The wide slit on the cuff makes it easy to remove the inflation bag. The watertight cap prevents liquid from getting into the inflation bag during cleaning. You can easily clean and disinfect the cuff. Yawara Cuff 2 is available in a full range of sizes from child to adult thigh. "25 dialysis patients answered a questionnaire about discomfort during iNIBP measurement with a Yawara Cuff 2. 20 of the patients reported that inflation was painless. iNIBP and Yawara Cuff 2 greatly reduce patient stress during NIBP measurement. With Нихон Koden's iNIBP and Yawara Cuff 2, you can provide all your patients with rapid and gentle non-invasive blood pressure measurement.